Good afternoon, dear students. You, as usual, in Saturday, come to our translation anatomical course of viscerology, and today we are going to talk about reproductive female system. I hope the translation quality is good and everything clear what I talk to you. I see only Ahmed today and Sarah also present. It's fine. Two students. That is very good. And please let me know if everything is correct with the quality of translation, if you can hear me clearly. Well, thank you. So now let's come to the lecture, and this is the very interesting topic for not only for doctors, but that is also interesting information about anatomy and physiology of and function of the female genital organs. This is a combined name, combined term. All organs are combined together in female reproductive system, and that is very important topic because we will talk about the beautiful half of the Homo sapiens species, and all of us have to be very grateful to the woman because we were born and could see this wonderful world thanks to them. Two things that changed my personal outlook when I was studying medicine. And one of these things that not shocked but surprised me and experienced me was the fact of the childbirth. What I see in during my education period. And female reproductive organs ensure that maturation of the oocytes create conditions for their fertilization and implantation of the ovum. That is very important process. And then after implantation, female reproductive organs bear of the fetus and carry out provision of labor. In addition to that, the reproductive female organs produce female sex hormones, determining the development of female genital organs, forming also secondary sexual characteristic and sexual behavior of all women. So let's start, and this is the issue we are going to talk today. We start from the internal female genital organ, then I hope we take a look of the external female organ, and a couple of words about development. If we have time, we also discuss the perineum, female and male perineum, and the breast, the organ which used during after childbirth and feed the baby. Well, female reproductive organ, according to the topography, this is the same classification, and the same classification using the topography principle. We distinguish external female reproductive organs and internal organs, as well as in the men. So the external organs can be examined visually. They are visible organs, but internal organs located in the pelvic cavity, and we couldn't see them without special gynecological examination or some kind of technical way of examination, like ultrasound or CT or tomography. And sometimes special gynecological examination is very important, because we don't have ultrasound apparatus and CT tomograph computers everywhere. So it's important for doctors to understand the and can provide special gynecological examination. And as you see, the border between the external and internal female organs is the hymen. Hymen is the reduces part of the cloac membrane, and that is visible better for virgins, but in the adult woman, it is located only like some small structure of the hymen. It is not the real hymen. It is what is the finishing part of the hymen. Let's call it that. And next picture show all female reproductive organs, and that is animated figure. And internal organ, I show you ovary. This is number 1, and uterine tube, number 2. Uterus, very important unpaired organ in the female pelvic. And vagin, this is also the 4th internal organ. External organ, there are a lot of external organs in comparison with men, and this is mons pubis, then labia minors, labia minoria, sorry, this is a mistake, labia minoria, and or labium minor in Latin. Then there also major labia majoria, the clitoris, great and lesser vestibular glands located inside of labia majoria and minoria as well. And some of the internal hidden structure called bulb of vestibulum. This is a special organ. It is the analog of the corpus spongiosum of the penis in men, and this organ located in the base of Labia Majoria. And hymen also, this is a membrane. This is a membrane between internal and external reproductive organ. Let's talk about first we are going to talk about internal female organ, and we start from ovary. Ovary is the gland, is a female gland located in the pelvic, on the side of the small pelvic. A typical ovary is a flattened oval measuring approximately 5 centimeter long and 2.5 centimeter wide, and about only 8 millimeter thick. So it is a flattened organ with the small weights. Each ovary weighs about from 6 to 8 grams. These organs you see here, I show, this is one, the left ovary and right ovary. Ovary are responsible for producing oocytes. This is the female cytes, and also ovaries secrete hormones, female hormones. They have no peritoneal covering, and it is very important. So this is only one organ which is located inside peritoneal cavity, but there is no peritoneal covering. So it is just a small and thin epithelium covering, but that is not peritoneum. And each ovary is stabilized by the mesovarium and by the proper ovarial ligament and suspensory ligament as well. So there are 3 fixing structures for each ovary. The first one is the mesoovarium, that is here, mesoovarium. Then this ligament we call proper ovarium ligament, and also the margin of the mesovarium is called the suspensory ovary ligament. So number 1, number 2, and number 3. Fixed structure fixing these organs in the lateral side of minor pelvis. The vessels come to the ovary through the mesovarium, and that is visible here. The vessels come in such way, and sometimes it is another source of. So ovarium has 2 sources of the blood circulation. So there are the vessels coming to the ovarium from the uterus artery and veins, but also this is the personal vessels coming from the place where the ovary was developed, was formed, in the embryon, in the embryonal period of their life. So this is very important for the surgeons, for gynecologists who operated ovarians. They have to understand that this organ have double sources, double sources of the blood circulation. Okay, and we also take a look here, and please remember another name of the ovary. We call them ophoron in Greek, and sometimes it is a common name in clinic, in gynecology. They call ophoronectomy, for example, but ovarium is the Latin name. This visible the structure, we call this part of the ovarium meso-ovarium. This is a connect to the mesosalpinx, fixing the uterus tube, and this is the internal structure and internal anatomy of this organ. And regarding to the location in the pelvic, we distinguish two surfaces, medial and lateral of the ovary, then two edges. This is a free and mesenteric. This is mesenteric edge, and this is free edge. I hope you understand why such name. And two ends. One ends we call uterine, and the distal or posterior end we called tubal, because it's close to the uterine tube. So that is a gross anatomy of the ovary. And histological examination show different cells inside of ovary. Each ovary has a pink or yellow coloration and nodular consistency, covering the surface of ovary here. This is a mesothelium, so there is no peritoneum, only mesothelium. It is very thin cells covering the ovarium. The cells located close to the surface here, they are visible. We called gametes or primordial follicles, and there are about 20,000 follicles located in the cortex of ovary. So this part, external part of the ovary, we call cortex, ovarian cortex, and the internal part of the ovary we called medulla. So like in the other organs, for example, thymus, or for example, suprarenal glands, they also have cortex and medulla. So, and the same situation we see in ovary, cortex and medulla. But functionally, the cortex consists a lot of primordial follicles or gametes. This is the This is the primary female cells which can grow and form such follicles. That is, inside of the follicles we see the ovary, and but these primordial follicles usually the quantity or the numbers of follicle is the same, and they development during embryonal period, and then start one to next, the cortex of ovarium produce only one cells in the month, and this is a growing cells called follicles, but the gametes located in the cortex called primordial follicles. That is the difference. Okay. Next figure shows the typical ovarian cycle and the process of the oogenesis. It is very important process. So you see here in cortex primordial follicles here. This is about 20,000 items, such cells. Then usually one follicle start to grow, and the growing is take more than a couple of months, but only one follicles has this is we call them mature follicle, and it consists oocyte. This is the female genital site, which is only one, and one time during months, usually the period between mature follicles break in near to the surface of the ovarium, and the oocyte come to the peritoneal cavity and call ovulated. So this process, when the oocytes come from the ovarium to the peritoneal cavity, call ovulation. Usually ovulation take place one in the month. Next next picture show the process of ovulation and histological picture of different follicles. This is a primordial follicles. This is the basic oocytes. Then formation primary follicles, then secondary and tertiary, and this is tertiary ovarian follicles is matured follicles, and this is the process. You see the process of ovulation when oocytes come to the peritoneal cavity. But the place after the realized secondary oocytes, this is the place transform into the corpus luteum. This is cells producing one of the important hormones we call progesterone. And if there is no gravity, then it decrease, and we see only the corpus organs are located near to the ovary, and this is the oophoron and paraoophoron. Usually they are located in the mesoovarium, and anatomically or embryologically they are the parts of the mesonephric duct. Usually this source of organ, of the reproductive organ, produce male reproductive organ, but it's also presented in female body in the form of the oophoron and paraoophoron. I hope you understand that is a rudimentary organ. Rudimentary organ are equal to the female genital organs in women. Uterine tube, next organ. It's really looks like a tube. We called them fallopian tube. That is a personal name, fallopian tube, or tuba uterina. Tuba uterina in Latin, and the Greek name is also important. We call them salpinx in Greek. This long structure are paired organ, uterine tube. So we should call such organ hollow organ, and usually the length of the tube is about 13 centimeters, sometimes 10, sometimes 11, but it is a standard size, standard length of the uterine tube, and it is about 10 millimeters in diameter. Such organ has four portions. There are four portions in uterine tube. We see the first one here. This part we call infundibulum, and the largest part with the it is thick and diameter is larger than other, called ampulla number 2. Then it's called isthmus, and small one part located inside of the uterine we call uterine part, or intramural part of the tube. I hope that is understand. And if you see the internal surface of the tube, especially with the scanning electronic microscope, you see different cells having the special processes, and they can move, and usually they work as the structure pushing the oocyte and let oocyte go to the uterine. I'm sorry. And another cell secret some mucus, which is the environment of internal structure, and it serves as the mucosal or some like biological fluid helping helping masculine cells, spermies coming and survive inside of uterine tube. So that is very important cells. I hope my colleague in histological, our department, the histological part, tell you more about these unbelievable cells inside of the uterine tube. And you see that some of layers, because the uterine tube is hollow organs, and it has also muscular layers inside, and because uterine tube transports the oocyte or material along the uterine tube, and it involves a combination of ciliary movement and peristaltic contraction in the wall of the uterine tube, and it is possible because of the muscular layers. A few hours before ovulation, sympathetic and parasympathetic nerves from the hypogastric plexus turn on this beating pattern, and the infundibulum touch the surface here. This is follicle. With follicle is about in ovulation process, but infundibulum touch this place on the surface of the ovarian and help the oocyte come into the uterine tube. And usually oocytes must encounter sperm during the first 12 or 24 hours after sexual contact between men and women, and this process is called fertilization, when the oocytes come in combined with only one sperm cells. And usually fertilization occurs in the ampulla of the uterine tube, in this part. So I may say that uterine tube is an important organ providing the fertilization. Let's call it that. And here you see the process and phases of the fertilization. First, this ovary and the follicles, matured follicles, and ovulation, and you see the ovary with the sperm around them. Only one sperm come into the ovary cells, oocyte, and form the fertilized ovum, and then it start to develop, and usually in 30 hours we see 2 cells, then 8 cells. About it is about 3 days after fertilization, and then 4 days when the fertilized oocytes, ovum, come into the uterine cavity, and then contact with the mucosal endometrium. We call this layer of endometrium, and the process called this is this is Gastrula Implantation. Sorry, I forget the name. This is implantation of the ovum in the endometrium is the most important process in the personal life. Usually the implantation of the gastrula, this ovum we call gastrula, and it is occurred with a probability of 50%, 50-50. So only a half of fertilized ovum can be implanted in the endometrium, but other died. So next picture show the uterus, unpaired organ in the female pelvic cavity between rectum and uterine and between the urinary bladder, and as you see, there are four parts of uterus. First one is the fundus, and here, sorry, this is the fundus. This is the upper part. Then body, here, body. Fundus and body are located inside of peritoneal cavity, inside of small pelvic. But this part we call cervix. It is located close to vagin, and some part of cervix are in the vagin. And inside of the uterus there is the cavity called uterine cavity, and usually this cavity have trapezoidal or the triangular or pyramidal form. The largest part is up, and the thin and narrow part is prolonged into the cavity of inside of cervix. This is Latin name uterus. It is also common name in English, but Greek name is another, and there are two Greek names of the uterus, Mitra and Hysteros. All of these two names are used in clinic by doctors. Next slide shows the uteral position in the pelvis, and as you see, that organ located very specific with the angle between body and the cervix, and this angle we call flexion. It means that body is flexed anteriorly, and there is the angle. Then you take a notice that all uterus is flexed or is located anteriorly, like it is close to the anterior wall of abdominal cavity, and this process we called anteversio. So this is the version, you see, and flexion. Sometimes we call this topographical position like anteflexion and anteversion, but flexion and version is also common names. The uterus fixed by ligaments, and this organ has got personal ligaments, and you see the one of the largest ligaments called broad ligaments of the uterus. This is like a membrane located in the frontal position. Then next, number 2 is a round ligament. Usually it's fixed between the uterus body and between uterus cervix and come to the inguinal canal. This is the analog of the male gubernaculum testis, which is responsible for the testis depressing during embryonal and fetus period. And the third ligaments we called cardinal ligaments. It is located. It's located down and usually fixed cervix into the fix them close to the vagin. Here, another position of the uterus. That is lateral position. Sometimes it is we call lateral flexure, or this variant is called lateral versio. And you see the size and of the vagin is different. Sometimes it is short and very short vagin. Sometimes it is long vagin, and it is also depend on the size of the vagin. The uterus located differently. And it is interesting also that during different physiological changes in organs, in the pelvic organs, it is visible how uterus change its position. This one is number 3, when the urine bladder is full but rectum is empty. And another number 1 is when the bladder and rectum is empty. But the number 2 is when all those organ, bladder and rectum are full. So it's interesting how uterus can change its position in the pelvis. Next, I'd like to show you the the structure of the uterine wall, and we distinguish 3 layers. Number 1 is which is located inside. This is the blue part of this picture called endometrium. This is the mucosal layers, which has a special name in uterus, and it is endometrium, because here are located a lot of glands producing secret. This is glands of endometrium, and there are a lot of spiral arteries. They come from the myometrium, the second layer, and usually they have spiral structure. Myometrium is the muscular. Here is let me show. This one is all of these are smooth muscular cells forming myometrium. And this is a walk layer, because the myometrium is responsible for contraction of the uterus during a process of birth. And the thin layer, external layer of uterus, called perimetrium. Perimetrium, this usually may be a serosal layer, usually the fundus and some part of the body of uterus is covered by peritoneum, but the cervix usually is an adventitial layer. And please remember that the three layers of the uterine wall. Here the visible myometrium, of course, it is the most important layer, and the myometrium can be divided into three layers. The outer and inner layers are thin and consist mainly longitudinal and obliquely arranged fibers, but the thickest is the middle and have circular direction, and it is visible here. That is the biggest one. Well, interesting changes during the period of life are visible, especially after the childbirth. The epithelium covering endometrium in the cervix uterus, it is a special epithelium, and we name it as a cervical epithelium. But the vaginal portion of the cervix covered by the another vaginal epithelium, and after birth, because the cervix of uterus was opened, and the cervical epithelium becomes visible by the vaginal examination. And sometimes people, gynecologists, believed that that is a pathological process and call that erosion of the cervix, and they thought this is a result of the degeneration of the epithelium. Now it's clear that this is a misdiagnosis, because that is a result of eversion. That is the process when the epithelium became visible, called eversion of the cervix uterus. Here, this picture demonstrates cyclic changes in the endometrium, and there are three phases of the changes. First is we call menses, when the endometrium is thin. This is the it is broke down, and this is a bleeding from the endometrium, because the spiral arteries were destroyed. And usually this period takes place about 5 days every month, and this process called menses. from the uterus the blood bleeding coming into the vagina. Next period is next phase called proliferative phase, when start to regeneration endometrium, and you see the new glands and some of small folds of this organ. Usually it takes place about 10-12 days, and it is finished when all glands start produce the secret, and this is before ovulation, before oocysts come from the ovarian into the peritoneal cavity. Usually it takes place 10, 14, sometimes 14 days, and this is a period when women can get baby, can become mother. And interesting, all of these phases are here. Means is about 7 days, 7-10 days proliferative phase, and about 14 days. This is secretory phase, where as you see, ovulation is between proliferative phase and secretory phase. These diagrams show different hormones. Estrogens, this is the hormones of the ovarian, and progesterone, this is the produced from the luteum corpus, these special cells producing progesterone just before the menses period, or during all period if implantation was done. And here the hormones of the hypophysis, and also visible that's luteinotrope hormones and follicle stimulation hormones are responsible for the ovulation. So all of these processes are controlled by female hormones, and it is very important. Here you see this special examination, X-ray examination of internal female organs, called Hysterosalpinkography, because hyster it is uterus, salpinx is uterine tubes. And why doctor needs recommend such examination? Usually, if there is no cavity, when there is no combination or connection between peritoneal cavity and uterine cavity, there is no possible. It is not possible to get baby because no ovarian come into the uterine cavity. So sometimes after inflammation, after some infectional diseases, the connection, the cavity of the uterine tube is break down, and it's no way between peritoneal cavity and uterus cavity, and to check it is possible by such examination called hysterosalpinkography. It is popular especially for women who would like to have a baby. And the last internal organ called vagin, Greek name is kolpos, located in the below part of the female pelvic. That is, of course, like a uterus and paired hollow organs, and vagin connects the uterus with the external genitalia. This serves for copulation and removal of menstruation, the fluid from the endometrium during menses, and removal of the fetus during childbirth. The vagin looks like a tube. This is a tube here, and it is about 8 or 10 centimeters long, and usually that is the angle between vagin and horizontal position. This angle is about 110, from 110 to 130, 110, sorry, to 130 grade. That's normal position of vagin in the pelvic cavity. The thickness of the vaginal wall is about 3 millimeters. I mean, this part we call posterior wall and anterior wall. Usually that is no more than 3 millimeters thickness. The lumen of the vagin is normally in a collapsed state, and in cross section has the form of the frontal fissure. So this is cavity. This is the vaginal cavity. It looks like a frontal fissure located in the frontal plane. And of course, the vagin has a constitutional feature. The largest vagin was registered in the 19th century, and one woman named Anna Swan, he has the largest vagin in history, and she gave birth to a child of 10 kilograms, because her vagin was about 26 centimeters, and about 26 centimeters. It is interesting. She was very high, very tall, and large woman, and such record was the record of the size of the vagin was in the history. Next picture show vagin, and we distinguish the upper, middle, and the lower part of the vagin. The upper part of the vagin connects to the cervix, uterine, and is called the vaginal fornix. These two split to small cavity is fornix of vagin. Here visible anterior fornix and posterior. As you see, posterior is deeper, and this place, vaginal fornix, posterior part, usually serve as a container for the sperm. Here come the spermatozoid spermi during the act or during intercourse. The lower third is well innervated. I mean, here part is very good innervated. Unlike the other parts, these parts have not many nervous findings, and it is important because this part usually enlarge during childbirth, and the vaginal examinations took place many centuries ago, and I would add that first gynecological mirror, it is a special instrument used for vaginal examination, was discovered in 1300 before Christmas birth, and on the ruins of the Pompeii. This is a part of Italy now. Here you see the posterior wall of the vagin, and anterior wall usually shorter than posterior. The difference is about 2 centimeters. Here you see posterior, the longest wall of the vagin, and it is interesting fact that sometimes during development it may be double vagin for women. It is interesting fact. I discuss it later. And here you see anterior wall of the vagin. It is visible here, and what is interesting here on the close to the close to the vestibulum of vagin, we see this is a border between here the hymen and the inferior part of the anterior wall has special urethral carene here, and in 60s last century, a lot of discussion was about the point point G or G spot on the anterior wall of the vagin. For the first time, the point G is mentioned in the works of Dr. Gravenberg in the 60s, and he described an unusual, from his point of view, unusual and phenomenon, the release of fluid from the urethra in some women during orgasm, when stimulated precisely by the anterior wall of the vagina, by this point, and he believed that is a special point helping women to get orgasm. But then here you see this point, G point or Grafenberg spot, but actually in the last decades there are a lot of examination, anatomical, histological examination of this part. Nothing special was not nothing special was opening, so we decided now this is just the part of the just the interior wall of the vagin, and there is no special sexual point, G point in the vagin. Here you see histological structure of vaginal wall. On this slide we see the 3 layers of the vagin, consisting of the mucose. Here is the mucose, and all of this is mucose. Then the muscular layers, and external layers is adventitia. Mucous membrane is firmly connected to the muscular membrane, so this is a close contact, and there is no submucosa in the vagin. Notice that no glands, here no glands, so no secrets come into the vagin, and also the special folds called rugin of vagin, and that is here the special fold, rugin of vagin, and they have all of this rugin have transversal direction, and outer or adventitial membrane of the vagin, tunica adventitia, this is here, consists of loose connective tissue and contains a large number of elastic fibers, sometimes smooth muscle fibers like in the muscular layers. Here only smooth muscle cells are located in the vagin. No conscious involved in the contraction of these muscles. Just unconscious process. And here you see the changes take place during the life period. For mature age women, the mucosa of the vagin are thick, but after menopause, this is a period when women cannot get babies because the process stopped already. Usually it takes place after 50, sometimes after 55 years old, and you see that mucosa of the vagin becomes thin, very thin in comparison with the mature age. Next we come to the anatomical studying of female external organs, and unlike the external male genitalia, the presence of the male genitalia is visible. Male external genitalia are visible, and everybody knows how they look like. But female external genitalia have always been a taboo topic in various cultures. It was not a good idea to discuss the external genitalia, but we are doctors, and we have to know these organs because they are very important. And let's see what kind of organs are in group of female external genitalia. Sometimes the name of the external genitalia is vulva. It's a common name of all organs located of external genital organs located in the perineum, of female perineum. So you see the first one is the mons pubis. This is the area of the lower part of abdominal wall, anterior abdominal wall, and with the special connective tissue and adipose tissue in women. Next to the mons pubis located labia majoria. This is two folds. This is real big folds, and this name is labia majoria. Labia minoria located in the between labia majoria and form opening called vestibulum of vagin. Then small organs. Let me show just the its anterior part called clitoris. This is the analog of penis in male body, and this is the analog. Usually, this is the organ giving women the sexual excitement. Next organ located in the base of labia majoria. Usually, it's located here and not visible from by the examination. It is just small and located, but it is also external organ called bulb of vestibule. Hymen, this is the membrane. This is the part of cloac membrane, and as I said before, the hymen, right name, pronunciation should be hymen, not hymen. Hymen in Latin. Hymen is the border between internal and external female genital organs. Two type of glands located in the external area. Greater vestibular glands located usually here in the base of the labia minoria and majoria. They really have maximal size and visible. Their points of ducts come in the area of the vestibulum vagin, and small vestibular glands. They are real small, but located in the different position of labia minoria. Let's consider each organ in more detail. Mons pubis. This is or venous tubercle. Sometimes they call mons veneris. Sometimes lunar hillcock in Russian culture. But that is lowest part of the anterior abdominal wall here. And unlike men, female pubis rises above the pubic symphysis. It means it is more visible. It is like a tuberculum in female body. And due to the well-developed subcutaneous fat, you see here a lot of adiposal fat, and it is look like a tuberculum. We see heterogeneous subcutaneous fat on a plastimated specimens on women, but we also see the some kind of connective tissue in this area. I would say that there are many nerve endings in the pubic skin of the woman. Touching or pressing here, I mean here a lot of nerve endings, and they could be involved in the sexual excitement, and such maybe this idea that Myon's female pubis is looks like a hillcock, like a tuberculum, and there are a lot of neuron aging despite of the in comparison with male. So the idea to classified the female pubis as genital organs. It's interesting because for men we don't call male pubis as genital organs, but in women we do. This area has also a dark hairline and forming a triangle. This is a typical triangle form of the hair, is with a sharply defined upper horizontal border and downward apex. The unguinal folds here, unguinal folds serve as a lateral border of the pubis, and it is interesting fact that pubic hair, unlike other parts of the body, unlike other hair located in the head or the axial cavity, has a very specific structure. They are thick, hard, and twisted. So all of these hair are hard, thick, and twisted. This way, the insects lived here, called pubic lice, don't live on the other hairs, only in the pubic. It's interesting fact because of the anatomy of the pubic hair. Appearance of pubic hair and the development of pubic adipose tissue occurs at the beginning of puberty, the period when child becomes a virgin and start produce the oocyte. The insufficient number of pubic hairs in adult is a sign of infantility of genital organs. Sometimes when we see no hair, the doctor decides that is infantility, that is a bad development. And after menopause, when after 55 or sometimes during after surgical operation, when surgeons removed ovarians, it's called castration. The pubic hairs become thin and lose their ravens. Female type of hair growth is determined by estrogens. All of these signs, the horizontal position, it is a result of hormones, female hormones called estrogens. Usually, in comparison with the male have such as form of the pubic hair, but female have horizontal position. It's interesting. And come to other organs. This is Labia Majoria. Labia Majoria are two skin folds, and this is right and left Labia Majoria, and located of course in the pubic area. They form an anterior commissure here. This is the anterior commissure, or let's see, here is the anterior commissure, And in perineal region they converge into a posterior commissure. Here is also posterior commissure between labia majoria. The split-like space, I mean this space between the large labia is called the genital cleft. Here is genital cleft. The skin of the labia majoria contains a lot of adipose tissue with connective tissue and venous plexus. It is visible here, a lot of adipose tissue. Here, these two folds are labia majoria, a lot of fatty tissue, venous plexus, and it is also the place where located vestibulum, great glands of vestibulum. Here, usually here. And interesting that the skin of the labia majoria, I mean skin here, is more pigmented and may differ in shade from the normal skin of the body. Usually it's more pigmented area. Labia minoria is two small folds, and they form in the upper part the special connection with the clitoris called prepuce of clitoris and frenulum, and in the posteriorly they gradually decreased and become thinner, connect with each other and form transverse fold we called frenulum of the labium or fourchette. But the gap between the labia minoria called vestibulum of the vagin. They form the space called vestibulum. Here, this is name. So between labia minoria is the genital cleft, but vestibulum is between labia minoria. That is interesting. In the vestibulum is opening, urethral opening, in female urethral opening. That's here, where place when we doctors should to put catheter during catheterization of urinary bladder. Here visible in the more pigmented labia minoria, and this is the place. This is vestibulum of vagin. Interesting fact that like their name, labia minoria, in 30% of women may be smaller. Maybe larger than labia majoria. Here you see the 70% that labia minoria is shorter, but here this patient has this girl has longer, or woman, I don't know, has the longer labia minoria, and it is absolutely normal. So more right, labia majoria should be called external labia, and labia minoria should be named internal labia. But that is the history, and you have to take in consideration that sometimes labia minoria is larger than majoria. Well, next organ is clitoris. This is analog of male penis. Usually it has two two peduncles or screws coming in the contact and form corpus of the clitoris, and the external part of the clitoris called glans clitoris. That is visible here. This is the glans, this is the corpus, and two screws of the clitoris connected to the pelvic, to the pubic bones. It's also visible here the form of two crosses. Then clitoris located between the mons pubis and the lowest part, just below to the pubic symphysis, and connected with the ligament, deep transfer the deep sagittal ligament suspending clitoris and form them. And here also the whole form of the clitoris with two. Take a look here. This is the bulb of vestibulum, another external genital organs. And I told you already, I have told you already about vestibulum of the, what does it mean. And this is the hymen, different form of the hymen. And usually the hymen is in the mature woman in post-pubertal form. It is not like a membrane, it is ends, some parts of hymen is visible. Bulb of vestibule, here take a look. This is a part organ connecting between each other, right and left bulbs, just under the clitoris. And that is if clitoris is analog of the I forgot, just a moment. This is a two paired organs in male penis. Sorry, this is the end of day. The cavernosal corpse, but bulb of vestibule is the analog of the spongiosum body in male penis. It's located like two bulbs, real, and here you see the greater vestibular glands, and opening of these glands just on the internal surface of labia minoria. The greater vestibular are located under bulb of vestibule, but smaller located in the labia minoria folds. This is female urethra. Open are located in the vestibulum vagin, and here this is a short canal between urinary bladder and vestibula of vagin. Don't forget it, especially for the practice you will have in third course, special practice which doctor have to know. And as you see, the female urethra is short and large in diameter, and have special glands, urethral glands, located in the mucosal. This is special glands open in the urethra, female urethra. I'm sorry, my friend, this is all for now, because I don't have more time and don't want to keep you more. I put some information about the perineal and breast later, and I hope you will discuss it in practical lessons. This, if you have questions, please don't be shy. Don't take confused and give me your questions right now. I prepared also the small test for external genital organs and internal genital female organs, and you will find this test in Moodle. The test will be open till 19 hours today, so you have more than 3 hours just to pass this test. I don't think any other questions. I hope everything is clear for you. So just let me wish you a good day, and I hope. Thank you for your attention. As usual, we will meet each other in 2 weeks. I hope it will be the same day, Saturday. Thank you for your attention. It was your teacher, Professor Starchik from Department of Human Morphology, coming to you from Department of Human Morphology. It was nice to see you, and let me say your goodbye.